if you're a man over 50, I need you to listen closely. Because what happens behind closed doors, in that private part of your life that you probably never discuss, not even with your closest friend, could actually determine not only how long you live, but the quality of those years still ahead. Just last week, Mr. Roberto, 67 years old, walked into my office with a look I know all too well. That uneasy mix of discomfort and the need for answers. I've seen it 1,000 times in my career. "Doctor, there's something I need to ask, but I'm embarrassed," he said while avoiding eye contact. Right then, I knew exactly what we needed to talk about. That unspoken truth that most men hide, but that absolutely every single one needs to understand. My name is Dr. Marina Hernandez. I've spent the last 25 years treating men just like you, and today we're going to have a real, honest conversation. No filters, no shame, just you and me, as if we were sitting alone in my office. Because the truth about masturbation and your prostate is more fascinating and more crucial than you ever imagined. That small walnut-sized gland quietly doing its job in the background can mean the difference between reaching 85, playing with your grandkids, or facing a life-altering disease by the time you're 65. And here's the part that really blows my patients away. The key to all of this might be something as basic, as natural, and as human as how often you ejaculate. Yes, you heard that right, and don't feel embarrassed. This is evidence-based medicine. Mr. Roberto nearly spilled his coffee when I showed him the studies I'm about to share with you. But before we get into the numbers, let me help you. Visualize something that might change how you think about this topic forever. Imagine your prostate as the beating heart of a microscopic power station, working 24 hours a day without you even noticing. It's located just below your bladder and wraps around the urethra like a protective ring. Its main job? Producing the thick, milky fluid that makes up around 30% of your semen. But here's where it gets truly interesting. That fluid isn't just filler. It's a complex cocktail loaded with zinc, unique enzymes, citric acid, and proteins, designed to protect and fuel sperm on their long journey. Think of it like a survival kit for your sperm. Of course, the prostate doesn't work alone. It's part of a perfectly tuned system. The seminal vesicles, those two small pouches stuck to the prostate like conjoined twins, contribute about 70% of the total semen volume packed with fructose, which acts as fuel. And then you've got the testicles, providing less than 5% of the fluid, but delivering the main stars, the sperm cells themselves. Now, during orgasm, something spectacular happens. A two-phase process kicks in like clockwork. First comes the emission phase, where all these fluids gather in the rear part of the urethra like actors waiting for their cue. Then comes the expulsion. With rhythmic contractions, your pelvic floor muscles fire 3 to 10 times, shooting the fluid out with remarkable force. So when Mr. Roberto asked me if diabetes could affect this process, I had to be honest with him. Yes, absolutely. Diabetes can damage the delicate nerves that coordinate this entire sequence, altering or even preventing it altogether. But what Mr. Roberto really wanted to know, and maybe you're wondering the same, is this. Is it harmful to hold back ejaculation? And that's where we bust the first big myth. The straight answer is no. Not ejaculating won't directly cause you a serious illness. But wait, don't stop watching yet. That doesn't mean there are zero consequences. Think of it like water in a dam. If the water doesn't flow, the dam might not break. But the water goes stagnant. It loses oxygen and gathers debris. Something similar can happen in your prostate, especially if you're one of the millions of men dealing with chronic prostatitis, that stubborn, nagging inflammation that can make life miserable. Low ejaculation frequency can make these symptoms worse. It can intensify that heavy, uncomfortable feeling in the pelvis, that pressure that just won't go away, that pain radiating into the testicles or lower back. And here's the revelation. A groundbreaking study from 1999, confirmed again in 2020 and 2023, found something amazing. Men with chronic prostatitis who increased their ejaculation frequency, whether through intimacy or masturbation, reported up to 60% less pain. It's like flushing the pipes, relieving pressure, reducing inflammation. Mr. Roberto stared at me, wide-eyed. "Doctor, I thought it was bad, that it made me weaker," he said. "No, Mr. Roberto," I replied, holding his hand. What's bad is believing myths that pull us away from our health. And there's something else that often gets overlooked, something we only recently uncovered in a study published in Sleep Medicine Reviews in the year de 2023, your quality of sleep. It turns out that regular ejaculation triggers a powerful hormonal cocktail: prolactin, which induces sleep; oxytocin, which calms stress; endorphins, our natural painkillers; and serotonin, the hormone of happiness. Men who kept a consistent sexual routine, especially when it ended in orgasm, slept on average 23 minutes longer, woke up 40% less during the night, and felt more rested the next morning. It's nature's most pleasurable, effective, and free sleeping aid. But hold on. Take a deep breath, because here comes the part that will challenge everything you thought you knew. The million-dollar question: can frequent ejaculation protect you from prostate cancer? Let me take a sip of water. And while I do that, if this information feels important to you, if you think other men need to hear this, do me a favor. Subscribe to the channel, hit the bell icon, and like this video. It costs you nothing, but it allows me to keep sharing life-saving knowledge. I truly appreciate it. All right, brace yourself, because what I'm about to tell you is huge. Harvard University, yes, Harvard, conducted the most extensive and rigorous study on this topic in medical history. They followed 31,925 men over a period of 18 years. That's like studying an entire mid-sized town for nearly 2 decades. And what they discovered literally rewrote the medical books. Men who reported ejaculating 21 times or more per month, yes, 21 or more, had up to 31% lower risk of developing prostate cancer compared to those who ejaculated between 4 and 7 times a month. 31% less risk. Do you realize what that means? That's a bigger reduction than many expensive preventive medications can offer. And here's something critical I want you to engrave in your mind. It didn't matter how the ejaculation happened. The researchers made that crystal clear. It didn't matter if it was with a long-term partner, a casual one, through masturbation, during the day, or while dreaming at night. The protective effect was tied strictly to the physical act of ejaculation, not the context, not the romance, not whether it involved a partner, just the action itself. Mr. Roberto nearly choked on his coffee when I showed him this data. "But doctor, I've been a widower for 3 years," he said, eyes full of sadness. "Mr. Roberto," I replied, looking him straight in the eye, "your health doesn't depend on having a partner. It depends on the choices you make to care for yourself. And masturbation is not only normal, it's healthy." And in that moment, I saw something in his face I hadn't seen in a long time. Hope. But we're not done yet. An Australian study involving 2,338 men confirmed these findings and went even further. It found that men who ejaculated between 4.6 and 7 times per week, nearly daily, had a 36% lower chance of being diagnosed with prostate cancer before the age of 70. 36%. Let that sink in. That's more than 1/3 reduction in risk. Other studies back this up as well. A 2017 paper in the Journal of Sexual Medicine, a massive 2018 meta-analysis of 22 studies, a 2020 publication in European Urology, all pointing in the same direction. The more frequent the ejaculation, the lower the risk. The consistency of these results is so strong, so clear, that the medical community had to ask, why? What's the secret mechanism behind this protection? That's where science gets truly fascinating. There isn't just one answer, but rather several pieces of an extraordinary puzzle. The first theory is what we call the prostate flushing hypothesis. Picture your prostate as a sponge filled with tiny ducts and glands. Over time, potentially cancer-causing substances build up there. Environmental toxins, metabolic waste, chemicals from processed foods, even bacteria. Every ejaculation acts like a deep rinse, flushing those substances out before they can damage the DNA of your cells. If you rarely ejaculate, those toxins linger, like rust eating away at metal. It's like doing the dishes. If you let them sit for days, bacteria grows, the mess hardens, and it becomes harder to clean. Your prostate works the same way. The second theory involves hormones, and this part is essential. Frequent ejaculation helps regulate the levels of testosterone and dihydrotestosterone inside the prostate. When these hormones are balanced, cell growth remains under control. But when they build up without release, cells can start to multiply uncontrollably. And that's where trouble begins. The third explanation, and this one is brilliant, is the immune system theory. Regular sexual activity boosts your immune system, much like moderate exercise does. It increases the production of natural killer cells, those special cells that patrol your body, hunting down and destroying anything abnormal before it becomes a tumor. A study from the year 2024, published in Nature Immunology, revealed that sexually active men had up to 40% higher levels of these protective cells in their prostate tissue. And finally, we can't ignore the physical side, the muscle contractions during orgasm. Those powerful rhythmic contractions don't just feel good, they greatly improve blood flow in the pelvic region, bringing in fresh oxygen and nutrients, while flushing out waste. This reduces local inflammation and lowers oxidative stress, that silent villain that damages and ages our cells over time. It's like giving your prostate a deep internal massage every time you ejaculate. At that point, Mr. Roberto interrupted me. Doctor, so how many times exactly should I... And this is where I want to be crystal clear with you, because this matters. That number, 21 times per month, mentioned in the studies, is not a prescription. It's not a quota you have to reach like a strict routine. It's not some magic formula that applies the same to everyone. Sexual health doesn't work like taking a pill 3 times a day with meals. It's more complex, more personal, more human. The ideal frequency for each man is unique. It depends on your age, your overall health, your hormone levels, your lifestyle, your preferences. A man in his 50s does not have the same needs as a man in his 70s. A diabetic responds differently than someone without chronic conditions. What is clear is that both extremes, complete abstinence and compulsive excess, can be harmful. The key is to find your own healthy rhythm. For some men, that might be 2 or 3 times per week. For others, maybe daily. Some may feel fine with once a week. What matters is consistency. Whatever feels natural and comfortable for you, without pressure or guilt. Regular ejaculation appears to be just one more pillar of a healthy lifestyle that protects the prostate, along with movement, clean eating, stress management, and good sleep. That's exactly what I told Mr. Roberto. And now I'm telling you. Learn to listen to your body. Your body holds ancient wisdom. It knows what it needs. You just have to tune in, without shame, without myths, without fear. And now let me ask you something important. What do you think about all this? Are you surprised, relieved, concerned? Drop your thoughts in the comments. I'd really love to hear your experiences, your doubts, your point of view. This is a safe space for real talk, no judgment, because there's something else we still need to discuss. Something many men fear even more than cancer itself, prostate surgeries and their impact on sexual function. Let's start with the most common type of surgery, done for benign prostate enlargement, that condition where the prostate grows and squeezes the urethra like a hand tightening a garden hose, making urination difficult. Mr. Alberto, one of my patients, 72 years old, came to my office completely exhausted. He wasn't sleeping. He was getting up 6, 7, sometimes even 8 times a night to pee. And when he did, only a few drops came out. "Doctor, this isn't living," he told me. It was torture. In cases like his, surgery is performed to unblock the plumbing. They remove the inner part of the prostate that's blocking the flow, just like unclogging a drain. This procedure is known as TURP, or transurethral resection of the prostate. But now comes something many doctors don't explain clearly, and it causes a lot of anxiety. After this surgery, you'll likely experience what we call retrograde ejaculation. The semen, instead of coming out the usual way, goes backward, into the bladder. Why does that happen? Because during surgery, the internal sphincter of the bladder, the little valve that normally stops semen from flowing the wrong way, gets damaged. It's like a door between 2 rooms that no longer closes properly. And here's what you need to understand. You'll still have orgasms. The pleasure will still be there. Erections will still be possible. You just won't see the semen come out. You'll feel the climax, the muscle contractions, the release, but there won't be any visible fluid. Mr. Alberto looked worried when I explained this before his operation. "Doctor, does that mean I'm no longer a complete man?" he asked me, voice trembling. Mr. Alberto, I said, holding both of his hands, you are still exactly the same man. Your masculinity is not measured by a fluid. It's in your courage to face this, in your love for your family, in your will to live. Semen does not define your worth as a man. Now, when we talk about prostate cancer surgery, the situation becomes more complex. We're talking about radical prostatectomy, the complete removal of the prostate, often along with the seminal vesicles. It's not just emptying the factory, it's tearing the whole building down. Once these organs are removed, semen production stops entirely. The factory is gone. There's no more output. So, after this surgery, there's no ejaculation at all. However, orgasm can still happen. We call it a dry orgasm. That same sensation of climax and release, just without the fluid. Now, let's talk about the most delicate issue: erections. The nerves that control erections are located very close to the prostate, like electrical cables running along the wall of a building. During surgery, these nerves can be damaged. Mr. Carlos, 58 years old, asked me directly before his operation, "Doctor, will I still be able to make love to my wife?" Honesty is vital in moments like this. Thanks to modern techniques, robotic surgery, millimeter-level precision, we can often preserve those nerves. In fact, studies show that between 60 and 80% of men who undergo nerve-sparing surgery recover some level of erectile function within 2 years. But I won't lie. Sometimes the tumor is too close to those nerves, and saving them just isn't possible. Recovery takes time, patience, and effort. "Mr. Carlos," I told him, "I can't promise everything will go back to the way it was, but I can promise we'll do everything we can to protect your quality of life. And remember, intimacy with your partner is about so much more than penetration. Love, affection, and pleasure can still flourish in many forms." 6 months after surgery, Mr. Carlos came back to my office. "Doctor," he said with tears in his eyes, "my wife and I have rediscovered our intimacy. It's different, yes, but we're happy. After all this, these facts, these stories, these fears and hopes, I want you to understand something vital. Knowledge without action means nothing. It's useless to know that frequent ejaculation may protect your prostate if you don't act on it. It's useless to understand anatomy if you ignore your body's signals. That's why I want to give you a clear action plan, specific steps you can start taking today. First and foremost, get your PSA test done, the prostate-specific antigen. It's a simple blood test that can detect issues years before symptoms show up. If you're over 45, get tested every year. If you have a family history of prostate cancer, start at 40. And yes, the dreaded rectal exam. I know it's awkward, I know it's uncomfortable, but it takes 30 seconds. And those 30 seconds could save your life. I found early-stage tumors completely curable just through this simple exam. Mr. Roberto once admitted, "Doctor, I avoided this test for 10 years because I was embarrassed. Now I regret it every single day." Don't be the Mr. Roberto from 10 years ago. Be the one who never misses a checkup now. Second, maintain a healthy weight. That beer belly isn't just cosmetic. Abdominal fat produces estrogen, throws off your hormone balance, and inflames your prostate. Every extra pound is another risk factor. Third, eat smart. More vegetables, especially cooked tomatoes rich in lycopene. More fish with omega-3. More nuts and seeds. Less red meat, less full-fat dairy, less sugar, less processed food. Your prostate will thank you. Fourth, move your body. Sedentary life is poison for your prostate. You don't need to become an athlete. A 30-minute walk daily, taking the stairs instead of the elevator, dancing with your partner, playing with your grandkids. Movement is medicine. Fifth, manage your stress. Chronic stress inflames, ages, and weakens your body. Find your release. Valve, meditation, gardening, music. Whatever brings you peace. And sixth, the focus of our entire conversation, maintain a healthy, active sex life, whether it's with a partner or on your own, according to your rhythm, your preferences, your well-being. Now let me warn you about something crucial. The internet is full of scammers, people selling magic cures, miracle supplements, strange gadgets, and alternative therapies without a shred of real science. If someone promises to heal your prostate with green smoothies, magnets, crystals, prayer rituals, or anything that lacks scientific backing, run. Don't waste your money, and more importantly, don't waste your time. Time is the one thing we can't get back. And when we talk about cancer, time literally means life. Look, after 25 years in this field, after treating thousands of men, I've learned one simple truth. The men who live the best, who grow old with dignity and health, are not the strongest, the richest, or the luckiest. They are the ones who choose to take care of themselves, the ones who push past shame, the ones who take action. Mr. Carlos, the man with cancer, sent me a photo last week. He was at the park with his grandkids, teaching them how to fly. Kites, post-surgery with limitations, but alive, present, joyful. Mr. Roberto, the widower who thought his sex life was over, wrote to me a month ago. Doctor, I feel 10 years younger. I sleep better, have more energy, and best of all, I'm no longer afraid. Mr. Alberto, the one who had prostate surgery, came in yesterday for his checkup. Doctor, he told me, my wife and I are better than ever. Different, yes, but happier. That's what matters most. To be here, to hug, to laugh, to love, to live one more day. Now let me speak directly to you. Yes, you, the one listening to me right now. I know you might be feeling many things. Maybe surprised by what you've learned. Maybe relieved. Maybe scared. Maybe embarrassed about years of myths and taboos. And all those feelings, they're valid. You're not alone. Millions of men are going through the same thing. But you do have the power to change your story. Every day you delay is a day wasted. Your health, your life, your happiness, they depend on what you choose today, not tomorrow. So I ask you, no, I urge you to do 3 things. First, if this video helped you, if it cleared up doubts or eased your fears, share it. Send it to that stubborn friend who never sees a doctor. That brother who acts tough but knows something's off. That neighbor, that coworker, that family member who needs to hear this. You have no idea how much good you can do. One awkward conversation today might save a life tomorrow. Mr. Roberto tells me often, Doctor, I wish someone had talked to me about this 10 years ago. Be that someone for someone else. Second, subscribe to the channel if you haven't yet. Hit the bell to get notifications. Not for me, for you. To keep learning, to keep caring for yourself, to stay informed with life-changing information. Every week, I share practical tips, bust dangerous myths, and explain the latest science in plain language. It's your health, your life. You deserve to understand it. And third, the most important of all, take action. Not tomorrow, not next week, not when you feel ready. Today, call your urologist, talk to your partner, start showing up for yourself. If you want to learn how to read your PSA results, what to expect in your first urologist visit, or how to discuss these topics. Without dying of embarrassment, I've got specific videos for that. You'll find them in the playlist here. I also have a free guide. The 10 prostate symptoms you should never ignore. The link's in the description. Download it, print it, keep it close. Before I go, I want to share something personal. My father died of prostate cancer 15 years ago. He died because he was ashamed to go to the doctor, because he thought it was an old man's thing, because he believed he could tough it out. He couldn't. That's why I do this. So no other child, no other wife, no other grandchild has to go through what my family did. Every time a man pushes past his shame and walks into my office, I see my father getting the chance he never had. Every early diagnosis feels like winning a battle against the disease that took him. You have that chance. Don't waste it. Remember, your prostate is part of you, but it doesn't define you. Taking care of yourself doesn't make you less of a man. In fact, there's nothing more masculine, more courageous, more admirable than a man who dares to be vulnerable to protect his health and be there for the ones he loves. 21 times a month may sound like a lot, or not much, depending on your perspective. But don't obsess over the number. Focus on having a healthy, shame-free, fulfilling sex life. Your body is wise. It has evolved over millions of years. It knows what it needs. All you have to do is listen, respect it, care for it, And above all, remember, you are not alone in this. Millions of men are on this journey with you. The difference between those who live well and those who suffer in silence is simple. The ones who live well are the ones who ask for help. Be one of them. Make the call, schedule the exam, have the conversation. Your body is waiting. It's ready to respond. All it needs is for you to take that first step. And that step isn't backward in fear, it's forward in strength. Because taking care of yourself doesn't make you weak. It makes you brave. And you, my friend, are braver than you think. Mr. Roberto learned that. Mr. Alberto learned that. Mr. Carlos learned that. Now it's your turn. What will you do? Will you stay silent or take control? The decision is yours. But never forget this. The best time to plant a tree was 20 years ago. The second best time is today. Don't wait 20 more years. Your life matters. Your family needs you. You deserve it. Take care, and I'll see you in the next video.